Nosebleeds caused by stress, how to stop them. These are some of the things you can do and not do when experiencing nosebleeds because of stress. They are quite common these days. When a blood artery in your nose bursts, you have nosebleeds. Bloody noses are fairly common. Approximately 60% of Americans will experience a nosebleed at some point in their lives. Approximately 6% will require medical treatment. These percentages vary from one continue to another. One thing that stands out is the fact that nosebleeds are pretty common. There are different types of nosebleeds, mostly according to their cause or where they occur. Anterior nosebleeds are nosebleeds that occur near the front of your nose. They are frequently caused by your mucous membrane getting excessively dry or by a nick or scrape on your nose. These types of nosebleeds are rarely hazardous. Posterior nosebleeds, which occur in the back of your nasal cavity, are more serious. Individuals are often advised to seek medical attention when they experience such nosebleeds. A 2005 study found that nosebleeds accounted for 1 in every 200 emergency room visits in the United States. The statistics are almost the same in the United Kingdom. Nosebleed tickets are more likely to be obtained by young children and those over the age of 65. This is a phenomenon that has puzzled experts for a very long time. One of the reasons provided for this phenomenon is the increased activity among children as compared to the elderly. Stress and prolonged worry are also risk factors for nosebleeds. According to the Anxiety and Depression Association of America, more than 40 million adults in the United States suffer some form of anxiety condition. Therefore, avoiding these triggers is one way of keeping yourself from potential nosebleeds as a result of stress. Anecdotal information suggests that stress and worry are nosebleed triggers. However, it is more likely that stress and anxiety are linked to certain behaviors, health problems, and medications that cause nosebleeds. Treating a nosebleed caused by stress. A nosebleed, while not usually harmful, can be a stressful event in and of itself. Still, an individual needs to see a doctor if their nosebleed episodes persist. When a nosebleed occurs, there are things you can take to lessen your concern. Most of them are simple things that you can do without any assistance. It is important to note that these measures can overlap at any given point in time. Whatever is causing your nosebleed, the first-line treatment is the same. Number 1, sit upright. The first thing to do is sit upright, or have your child sit upright. You can as well sit or stand with your head slightly bent forward. Remember not to tilt your head back. Tilting the head back is a mistake that a lot of people often make when experiencing nosebleeds. It should be avoided at all costs. Number 2, apply a nasal spray. There is also the alternative of using a nasal spray. If you have an over-the-counter nasal decongestant, oxymetazoline or phenylephrine, you can spray it into the bleeding side of your nose. There are several benefits associated with the use of the nasal spray. Number 3, apply pressure. Because the blood vessels are near the nostrils, apply strong pressure to the soft front area of your nose rather than the bridge. The good news is that many people are aware of this pretty effective remedy for nosebleeds due to stress. Number 4, hold your breath and wait for the bleeding to cease. Keeping pressure on the wound for at least 10 to 15 minutes before checking to see if the bleeding has stopped is another great remedy for nosebleeds. If you relax pressure before checking, the bleeding may resume. This is a mistake that a lot of people often make. Number 5, try ice. If the bleeding hasn't stopped after 15 minutes, place an ice pack or cold compress on the bridge of your nose to constrict the blood vessels and aid in halting the blood flow. Unfortunately, this is a remedy that a lot of people do not consider despite its effectiveness. Number 6, remain calm. It is important to always remember that the more you panic, the longer it may take for the bleeding to stop. Therefore, the best course of action in the event of a nosebleed is to remain calm regardless of the situation. If you are still bleeding after 30 minutes, contact a medical expert. If you've tried everything and the blood still comes, What to avoid in a nosebleed situation? First and foremost, even if they appear to be fantastic ideas, there are some things you should not do. There is so much information out there, especially on the web, on how to curb a nosebleed. You could have even been informed that they are the proper technique to treat a nosebleed. Here are some things to avoid doing. Do not stuff your nose. This is commonly demonstrated in movies. Stuffing tissues or napkins up your nostrils may seem like a good idea to stop the bleeding, but it can irritate the lining of your nose and cause further bleeding when the stuffing is removed. Don't tilt your head back. You may have received this advice as a child, but medical experts advise against it. You don't want to tip your head back because the blood will flow down into your mouth and induce choking. In addition, the blood subsequently ends up in your stomach, causing discomfort. All this is avoidable. Don't keep an eye on it. When you apply pressure to a nosebleed, more on that below, maintain applying pressure. Don't check in every minute to see if it's still going. If you take the pressure off more frequently, the bleeding will take longer to cease. These are some of the do's and don'ts when experiencing nosebleeds due to stress, which are quite rampant these days.